Hello, my name is Fintan. I believe in letting nature take care of us, especially when it comes to our health. In this short video, I'm going to talk about Serrapeptase Pros and Cons. It's hard to believe that an enzyme taken from the silkworm and used for breaking down the cocoon that surrounds the silkworm could be so effective at pain relief, comparing favourably to prescription anti-inflammatory drugs without any harmful side effects. I'm talking about the much used proteolytic enzyme serrapeptase, first discovered by German scientist Dr. Hans Napier many years ago. So what is the hype surrounding serrapeptase all about? And what are serrapeptase pros and cons? Serrapeptase or serrapeptidase, a proteolytic enzyme in supplement form, is separated from the non-pathogenic enterobacteria Serratia E15. The supplement is entry-coated, meaning it easily passes through the stomach without losing any of its powerful anti-inflammatory properties before it goes into the intestine. Serrapeptase is absorbed into the intestine and transported directly into the bloodstream. From urine tests completed on serrapeptase users, we know that it's found in very small amounts, meaning that most of it stays in the bloodstream where it is most beneficial. Serrapeptase has been used for many years in Europe and Asia to treat inflammatory diseases like osteoarthritis, rheumatoid arthritis, and more recently it has been found to be very beneficial for people who suffer from chronic sinusitis. It has a role to play in cardiovascular disease by removing plaque buildup. There have been clinical studies in serrapeptase that demonstrate how effective it is at reducing swelling and pain caused by inflammation. It really is a superior proteolytic enzyme. Serrapeptase can dissolve dead or useless tissue without any harmful effects on good tissue. We need inflammation to fight against foreign invaders that come into our systems. Inflammation is a natural response, but too much of it can cause damage to bones, ligaments and cell tissue. Scientists have been trying for years to come up with drugs that can deal with inflammatory responses or diseases like arthritis, carpal tunnel syndrome, atherosclerosis, post-op wounds without the dreaded side effects. Well, now all of that is possible by using a natural anti-inflammatory such as serrapeptase. The original studies in serrapeptase started in Germany. It's now a popular treatment for swelling and inflammation. One double-blind study was done there to test it on patients following an operation to see if it would help with pain and swelling. 66 people had surgical treatment for a rupture of the collateral ligament in the knee. The participants were split into two groups, serrapeptase and a placebo. The serrapeptase group reported that after 3 days the swelling and pain had reduced by 50%. Even better, after 10 days they were pain-free. Unlike other biological enzymes, serrapeptase dissolves only dead tissue, much like the way that it doesn't harm the butterfly. So for better health, serrapeptase will only get rid of, for example, dead fibrous layers that clog up our arteries that are dangerous because of a restriction on the blood flow to the main organs, especially the heart. Following angioplasty, a technique where the cardiologist inserts a small balloon into the artery at the location of the blockage, serrapeptase will be the ideal treatment to prevent any further buildup of plaque, calcium and cholesterol. So to summarise, serrapeptase may be helpful in treating various inflammatory type diseases such as arthritis, carpal tunnel syndrome, COPD, bursitis, fibrocystic breast disease, chronic sinusitis and heart disease. Are there side effects? Well, everybody's metabolism, health and fitness levels will vary, as will the results taken serrapeptase. Most people won't have any effects, but those that do will be like reported side effects such as nausea, reduced appetite, joint and muscle pain, cough and skin reaction. This concludes my video on serrapeptase pros and cons. And to finish, serrapeptase is a well-tolerated enzyme. It doesn't matter whether it's used for inflammation, swelling, joint pain or wound healing. It is without doubt a natural alternative to prescription drugs. In fact, it can be used to supplement prescription drugs. Studies would indicate that the maximum amount to take in a given day will be 3 tablets. However, I suffer from a lot of hip pain. Sometimes I take up to 250,000 IU Serrapeptase tablets per day without any side effects. So for more information on this wonderful enzyme, please visit my website. Thank you.